Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Hi, everyone. This is Dr. Marie Brown, an internist here in Chicago and director of Practice Redesign with AMA Steps Forward at the AMA. Today on the podcast, we are going to discuss expanding coverage that will assist providers in the prevention of prediabetes and type 2 diabetes. And I am so excited. I have to cut to the chase. CMS now covers hemoglobin A1C testing for Medicare patients. We recently published a new AMA Steps Forward toolkit on this topic, and I am joined today by Dr. Kate Kirley, a family medicine physician and the director of chronic disease prevention at the AMA. She's also the co-author on this toolkit along with myself. Thanks for joining us, Dr. Kirley.
Oh, so glad to be here.
Given that diabetes prevalence is on the rise, how do we help our patients with pre-diabetes from going on to develop diabetes? Dr. Kirley, can you share a change in the 2024 Medicare physician fee schedule that could offer a path forward?
Yes, great news after years of AMA advocacy to really remove barriers to screening for prediabetes and undiagnosed diabetes. CMS has expanded Medicare coverage, like you said, Dr. Brown, for screening tests. So specifically, CMS is now covering the hemoglobin A1C or HbA1c test, in addition to the already covered fasting plasma glucose and oral glucose tolerance test. And this change really brings Medicare coverage in alignment with the United States Preventive Services Task Force recommendations.
This is absolutely fantastic because I, as an internist, would want to order this test. And unless you can assure the patient that it'll be covered, we really had this moral distress. I felt like I had one foot in each canoe. So I understand the A1C test has some important advantages over the other screening test options. Can you review those for us?
A major benefit for patients is that the HbA1c test doesn't require fasting, unlike those other screening tests. And I know as a primary care physician, I often found that my patients didn't realize what the fasting requirement was, or they had eaten for any number of reasons prior to their office visit. It can be difficult, especially for our patients on Medicare, to fast. And it can also be difficult for our patients on Medicare to come back to the office after a visit to do a laboratory visit. So this expanded coverage, we hope, will lead to more frequent screenings and hopefully also added referrals to the Medicare Diabetes Prevention Program. CMS has also finalized some proposals to expand frequency limitations for diabetes screening so that we can screen twice within a rolling 12-month period. And CMS has also streamlined the definition of diabetes by removing codified clinical test requirements, which are currently required for diabetes screening, as well as medical nutrition therapy and diabetes self-management training services.
So this is really exciting. This is really going to help the primary care physician tackle earlier and intervene. So what kind of impact do you think these changes will have on diabetes screening moving forward?
We definitely expect this to increase screening for diabetes for those approximately 65 million adults on Medicare. And also, I think it's really important for us to note that this screening test is available to patients with no out-of-pocket costs. So we really hope that it will increase access to screening and utilization of screening.
I think that's very, very important, and that's what patients want to hear. I found one of the most rewarding aspects of my practice was to find someone before they develop the diagnosis of diabetes. So what are the recommendations currently, and who should be screened?
Yeah, and you're right. The entire purpose of screening is to catch a risk factor before it becomes a disease so we can offer effective preventive interventions. And so when we think about who we should screen for prediabetes and type 2 diabetes, the screening criteria are actually the same regardless of which type of test we're going to use. but both the USPSTF and the American Diabetes Association do recommend regular screening for adults for prediabetes and type 2 diabetes. USPSTF tells us that we should screen adults who are between the ages of 35 and 70. So that includes Medicare patients, right? And these patients we should screen if they also have overweight or obesity. We can also consider screening at an earlier age if the patient's from a population that has a disproportionately high prevalence of diabetes.
So this really includes a huge number of most of the patients that we see. And I found that if I was able to identify prediabetes in a mother who's making all the meals for 4 or 5 children and their husband and was already obese, if I could get her to change, then the downstream effect might be that if she changes her diet, it'll have impact on her children and her spouse as well. So what are the implications of this coverage for the National Diabetes Prevention Program, which we'll talk about should be part of the standing order once an A1C comes back, so that it isn't all just more burden, more time for the very busy physician?
Absolutely. And I think that's a great question. And in case anyone doesn't know, the National Diabetes Prevention Program is an evidence based intervention designed to prevent type 2 diabetes. And it really has an emphasis on lifestyle change programming. And we have seen that structured lifestyle change programs have been shown to reduce the risk of type 2 diabetes by 58%. And in fact, among Medicare age people, the effectiveness of this intervention is even higher. So, if a patient is interested and ready to make healthy lifestyle changes after they have screened positive for prediabetes, then we really encourage doctors to refer their patients to a national diabetes prevention lifestyle change program at a CDC recognized organization. And I think it's important to note that Medicare covers the diabetes prevention program as a benefit for patients who have laboratory confirmed prediabetes.
So I found personally that National Diabetes Prevention Program, along with the regular diabetes education program, were critical to saving me time and keeping me on schedule and finishing my work when I left work. So that all of my patients who had prediabetes or had diabetes went to see these wonderful coaches who reviewed their medicine, reviewed their diet. They had the time and the knowledge to talk about the type of ethnic food that the person preferred. And they were much better motivators than I was and had much better results. I was also surprised, and this is in the toolkit that you wrote, Dr. Kirley, that Medicare pays for 2 hours of diabetes education in addition. So I had my patients who had diabetes seeing a diabetes educator every 3 months. Usually it was within the month of seeing me, and boy, did that save me time.
Absolutely. I think both the diabetes prevention program and diabetes self management education services are such an important extension of the primary care team. And it allows our patients to get these effective interventions by well trained colleagues who are really able to get our patients the preventive and lifestyle related care that they need.
Absolutely. And we, in the toolkit on prediabetes, a team-based approach that again is open access. We link to the National Diabetes Prevention Program. So you just put in a zip code. Sometimes it's your local YMCA. We just didn't even know. We put that into a standing order. They were so much more effective at including the diet exercise programs that were so effective with lifestyle. So there are 70 stepsforward.org toolkits. These are how-to, actionable, practical, simple toolkits to help you make changes in your office today so that you can deliver more efficient and greater quality care and finish your work at work. These include guides on pre-visit planning, T-based care to implement time-saving changes. Any other closing comments, Dr. Kirley?
I think we have covered some fantastic news. I'm just so thrilled that Medicare is covering hemoglobin A1C as a screening test, and I really hope our physician listeners and our care teams will take advantage of that. Thank you for having me.
Great. Thank you so much, Dr. Kirley, for joining us today, for authoring this wonderful toolkit, and for updating the audience on this coverage. It's about time. This podcast episode is supported by a cooperative agreement number OT181802, Strengthening Public Health Systems and Services through National Partnerships to Improve and Protect the Nation's Health, funded by the CDC. Its contents are solely the responsibility of the authors and do not represent the official views of the CDC or the Department of Health and Human Services.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.